Welcome to While We Were Distracted, the podcast where we explore topics that often get overshadowed in the rush of daily life.
Welcome back, everybody, to another deep dive. Ready to go beyond the headlines with me again. Today, let's just say the topic we're diving into is pretty thought-provoking. It's the idea that COVID policy might have been shaped by military and security concerns more than just public health, at least in the Netherlands.
Yeah, you could say that's raising a few eyebrows for sure. And luckily, we've got some really interesting sources to help us unpack it all.
Right. We've got this YouTube interview with a Dutch GP, Dr. Elle Van Veen, who's been pretty outspoken about her experiences during the pandemic. And then we also have a written statement from her where she really digs into this pretty explosive claim by the Dutch Minister of Health.
Oh, yeah, that's where things get really interesting. So the minister said, and this was in the context of pandemic preparedness, that COVID policy was actually driven by the NCTV, the National Coordinator for Counterterrorism and Security, and get this, even NATO.
Hold on, counterterrorism and NATO. That's not exactly what comes to mind when you think public health.
Nope, not at all. And this is exactly what Dr. Van Veen points to when she talks about how uneasy she was getting with how the pandemic was handled in the Netherlands. You see, the Dutch healthcare system usually relies a lot on GPs, like Dr. Van Veen.
So it's not just about treating illnesses. It's about that doctor-patient relationship, the trust built over time.
Exactly. Dr. Van Veen talks about this real sense of partnership with her patients. But then as the pandemic went on, she saw things shifting away from this personalized GP-led approach.
Shifting towards what?
Well, towards a much more centralized system with those mass testing and vaccination centers. And she argues this is where those military and security influences started to really show.
So instead of focusing on individual patient needs and making decisions based on open dialogue, it became about control.
That's her concern.
Yeah.
Yeah. It's really fascinating because she compares this to the traditional Dutch healthcare system, which she says has always been about cost effectiveness. Suddenly, with the pandemic, money seemed like no object when it came to setting up these huge operations.
Interesting. So we've got this shift away from personalized care towards a more centralized top-down approach, and it's seemingly driven by security concerns. What did Dr. Van Veen do about all this?
Well, she started speaking out, going to protests, voicing her concerns, publicly calling for more transparency in how decisions were being made.
And how did that go over?
No, well,
Yeah.
in her YouTube interview, she describes the police response at protests as really aggressive, and there was this growing crackdown on dissenting voices.
You mean people questioning the official line on the pandemic?
Exactly. And it gets even more concerning because she claims she was personally investigated and labeled a dangerous conspiracy theorist just for expressing her concerns.
Wow. Investigated just for speaking your mind? That's pretty unsettling.
Yeah, it definitely raises some red flags about silencing dissent during the pandemic. And Dr. Van Veen links this directly to that statement from the Minister of Health. She says it shows a mindset where security concerns were more important than open scientific debate and individual patient care.
So the whole framework changed. Instead of a public health crisis, it was a national security threat. And that changed everything.
That's what she argues, yeah. And it gets even more interesting when you look at her critique of how alternative treatments were handled.
What do you mean?
Well, she talks specifically about ivermectin. Some doctors thought it could be a potential treatment for COVID-19, but she says there was this real effort to suppress any information or discussion about alternative approaches.
Why would they do that?
That's a question she wrestles with. She thinks maybe there were conflicts of interest, or maybe they were afraid that allowing any deviation from the official line would undermine public trust. But for whatever reason, she sees this as a sign of what she calls the militarization of public health.
Okay, I need a little help here. What exactly does she mean by militarization?
She's basically saying that thinking of the pandemic as a security issue led to a more top-down command and control approach to healthcare. Think about it like the military orders come from the top and there's not much room for questioning or debate.
Right, it's about following orders, not really about thinking critically or looking at different viewpoints.
Exactly. And Dr. Van Veen worries that this kind of thinking got into the public health response. It created this environment where doctors felt like they had to follow the official guidelines, even if they had doubts or wanted to try other options.
Yeah, that makes sense.
Yeah.
If you're told it's a matter of national security, you're probably less likely to question what's being decided, even if it goes against your professional judgment.
And that's incredibly damaging, she says. Not just for the doctor-patient relationship, but for the whole medical profession.
It's like that trust we talked about earlier, that foundation of good health care. It just starts to fall apart.
Exactly. Dr. Van Veen sees this erosion of trust happening at different levels, between doctors and patients within the medical community, and between citizens and the government.
So it's not just about health care. It's about society. If we can't trust our doctors, our institutions, each other, where does that leave us?
It's a pretty serious thought. And Dr. Van Veen doesn't shy away from that. But she's not all doom and gloom. She does see a way forward.
Oh.
She talks about how important it is to have open dialogue and understanding between people with different views. She knows not everyone's going to agree on everything, but she thinks we need to find a way to have respectful conversations, even about tough topics.
That makes sense.
It's
If we just shut down anyone who disagrees with us, we're never going to learn from each other or find any common ground.
And she also sees hope in those alternative healthcare structures that are popping up. Systems that focus on what individuals need and on informed consent, where patients and doctors can work together as partners instead of one side telling the other what to do.
So it's not just about changing the system from the top.
Yeah.
It's also about individuals taking charge of their own health and finding options that fit their values and beliefs.
Exactly. And that brings us back to a really basic question. What does it actually mean to be informed about our health? Is it just blindly doing whatever the authorities say? Or is it about doing our own research, asking tough questions, and standing up for ourselves?
Yeah, it feels like we're kind of at a crossroads between just accepting what we're told and figuring things out for ourselves.
And that's exactly why Dr. Van Veen's call for open dialogue is so important. She really stresses how much we need to listen to and try to understand people who see things differently, even people we totally disagree with.
Yeah, because ultimately we're all just trying to figure things out, right? And if we just shut down anyone who doesn't agree with us, well, it just creates more division and distrust.
Exactly, and that's what makes this deep dive so important. We're going deeper, unpacking these complicated issues and, facing some hard truths.
So let's bring this back to you, the listener. Think about your own experiences during the pandemic. Were there ever times you felt like you couldn't question the information you were getting? Or maybe you felt pressured to go along with a certain narrative?
These are questions we all need to think about. And as we move forward, the things we learned from how the pandemic was handled will definitely shape how we deal with challenges in the future.
Absolutely. So here's something to think about. Could there ever be a legitimate reason to get security agencies involved in a pandemic response? Or does that automatically go against the basic principles of public health?
It's a tough one. On the one hand, you could say that in a really extreme situation, like where there's a clear and present danger to national security, maybe those lines get blurred. But then again, the whole idea of security agencies calling the shots on public health, it raises some serious concerns about overreach and people losing their freedoms.
It's a slippery slope for sure. And one we need to be really careful about, because if we forget those fundamental principles, things like informed consent, open scientific debate, individual freedom, what's to stop the next emergency from becoming an excuse to control our lives even more?
That's the heart of the issue. And that's why it's so important to have these conversations now while we still can. We need to learn from what happened in the past, both the good and the bad, so we can build a future where public health is guided by science ethics and a real respect for individual rights.
Well, we've definitely covered a lot today.
Yeah.
We encourage you to dig deeper into those sources. We talked about Dr. Van Veen's interview, her written statement, and of course, that statement from the Dutch Minister of Health. But most importantly, keep those questions coming.
Don't forget to like and subscribe for the next episode on While We Were Distracted.